coronavirus has placed an unprecedented level of challenges on healthcare sectors around the world. In recent months, EY teams have been working tirelessly to help respond to these challenges on the front line.
Like here right now.
Timing is critical.
Activity was really needed.
Let's take you to Spain now.
Spain has declared a state of emergency.
One of the world's highest death tolls.
In Madrid, lockdown restrictions caused the elderly population to be completely isolated.
Totally isolated.
Connection was non-existent.
This led to serious difficulties accessing medical care, placing many lives at risk.
Madrid was really bad. People couldn't get in and they couldn't get out.
People were perfectly well in the evening, started dying 14, 16 hours later. So it was incredibly overwhelming.
In collaboration with Open Salud, EY created a telematic medicine platform to reconnect elderly patients to medical professionals around the city. The platform was rolled out across the capital's largest care home facilities, where they could have the greatest and most immediate impact.
The clinical evolution was amazingly quick. It was a much more valuable model to treat patients inside the nursing homes by their own medical staff and helpers.
Realising that more lives could be saved, the EY team extended its provision across smaller care centres, creating a city-wide system connecting the health service and Madrid's most at-risk patients.
It has already set the basis to a very good consultation system which will last forever. The healthcare system will be much more prepared to face the enemy next time.
Across the United Kingdom, all hospitals are dealing with increased demand.
If we don't flatten the curve, we are going to start running out of space.
In the UK, figures predicted that as the virus peaked, demand for beds would increase by up to 4 times. This meant hundreds of extra beds, if not thousands. NHS North West urgently needed a functioning field hospital that could receive up to 650 patients.
We didn't have 24, 48 hours to wait. We needed to plug that need straight away.
Over a single weekend, EY teams drew together knowledge from advisory, logistics, consultancy and financial services to collaborate with the client and the military to establish an emergency operations centre, completing a 14-month project in just 14 days.
We have the phrase one EY. This was one EY at scale, rapid mobilisation across multiple service lines in an area that none of us had ever done. If there had been a major surge in the Northwest, this would undoubtedly have saved hundreds of lives.
The speed and success of this project has outlined a repeatable formula for the NHS and beyond.
Because the nature of the virus is different globally, we were able to bring the experience we gained to other countries now that are behind where we were.
Seriously short, so doctors and nurses don't know what's...
Hospitals across the US are facing devastating shortages.
Fear about a lack of supplies.
The system's overwhelmed. It's scary.
In the US, parts of the country were caught flat-footed with provision of vital PPE for frontline medical staff in what was one of the most critical supply chain shortages in modern medicine.
The pandemic highlighted this flaw within the supply chain. Health systems came to a screeching halt. Patients were having to put off care.
In the Carolinas, Novant Health needed to collaborate to ensure that they'd have the volumes of PPE to keep critical facilities running.
EY came to us, wanted to help us. You can't be a leader in innovation unless you have great partners. EY brought that expertise, and this tool that we developed, we built it together.
Whilst working with Novant to model and project demand patterns, the team at Ernst & Young India adapted their Asterisk tool to provide a solution that gave better visibility and predictability across the supply chain for 15 critical PPE items.
This is a dashboard that is interactive. It provides real-time expected surgical demand, and it alerts purchasing of potential shortages and outages.
But EY didn't stop there, as focus shifted towards helping to implement the tool across all supplies used in the region's operating rooms.
The impacts that this can have for other health systems, better predictability, better demand planning, I think that is the greater benefit that's come out of this.
The coronavirus pandemic in Latin America is worsening.
The health system is at breaking point.
The outbreak has been so severe, extreme measures had to be taken.
In Chile, a rapid surge in cases was exacerbated by a large influx of worried well, or patients entering the system because of suspected symptoms, and completely overwhelming medical facilities. The Ministry of Health set a deadline of 72 hours to receive bids for a solution that would triage these cases and help the healthcare system focus on patients in most urgent need of treatment.
The authorities were thinking if everyone that has a fever or cough go to the hospitals were going to be packed. So they said, look, we need to do something and we need to do something fast.
EY collaborated with RingMD to provide a stable telehealth solution that could be implemented quickly and securely, helping the public to access health assessments and treatment virtually.
Telemedicine is the perfect case for this. You want to talk to someone, I want to see who I'm talking to. We approached the global health team and we found a startup in the US. We spoke with them and we went live 72 hours after that.
In addition to supplying a solution to the public, the EY team also provided a communications platform to hospitals and medical professionals that allowed an unprecedented level of collaboration and data sharing between major cities and the most remote hospitals.
We built the second platform, so if they got a case in a remote location, they could talk to the special doctors in Santiago, so kind of a network of doctors speaking to doctors.
In the ministry's eyes, the bridging of this information gap was almost as important as the digital healthcare solution in the fight to control the pandemic.
Due to the connectivity between the doctors, they told us at least twice that we were able to save lives, which for us was a huge achievement.
It's been a great privilege for EY's teams to collaborate with some of the world's leading healthcare services, mobilising solutions on a global scale to help save lives. Beyond the global crisis, the collaborations formed and the critical solutions that developed with them could help reframe the future of healthcare for the better.